Gun violence recently surpassed car accidents as the leading cause of death for children in the U.S.
St. Louis is not any exception to that. It felt as though we were seeing children shot more frequently than in the past. And so that's why I, myself, and a few other doctors from St. Louis Children's decided to do a study to kind of dive a little bit deeper into that and see if we could find out if that actually was the case and other ideas why that might be the case.
Dr. Mary Beth Bernardin is an assistant professor of clinical emergency medicine and pediatric emergency medicine at the University of Missouri School of Medicine. She's the lead author of a study conducted at St. Louis Children's Hospital. The study shows how the COVID-19 pandemic is associated with the increase in the frequency and mortality of pediatric firearm injuries.
Not only did the rate of shootings go up, but the lethality went up as well. A lot more children that were shot needed to go to the operating room because of their injuries and needed the pediatric intensive care unit because of their injuries, and that the deaths due to shootings went up almost 30%. So there were very, very serious shootings.
The data is based on pediatric firearm injury victims taken to the St. Louis Children's Hospital emergency room, ages 0 to 19. And the data did not include St. Louis area children who died at the scene or taken to other hospitals.
We used something called the trauma registry at St. Louis Children's Hospital. We looked at the trauma registry during the 2 years that the pandemic was kind of at its height, from 2020 to 2022, and we compared it to the 5 years prior to the onset of the pandemic. Before the pandemic, we saw 6 to 7 children shot per month. During the pandemic, that went up to over 10 per month on average, and that was more than a 50% increase in children that we were seeing with firearm injuries.
Bernardin says the escalation in injuries was driven by a significant increase in firearm assaults and homicides, as well as increased frequency of children injured as bystanders during adult crimes.
The rate of accidental shootings and self-inflicted shootings pretty much stayed the same compared to the 5 years prior to the pandemic, but it was really the firearm assaults and homicides that went up really significantly. African American communities seemed to suffer the worst from this increase. During the pandemic in St. Louis, it was our African American kids that were affected much more so than other ethnicities.
Another finding revealed 3 spikes in monthly pediatric firearm assault and homicide rates during the pandemic, each happening within 3 months of a surge in COVID-19 deaths.
During times that COVID-19 deaths were really going up, sometimes associated with new COVID-19 variants, at the same time or within 3 months following that increase in COVID deaths, we saw increases in the pediatric gun violence as well. So the COVID deaths and the gun violence tended to go hand in hand.
She hopes the study serves as a call to action.
Gun violence is completely preventable. And so I hope that this study and that studies like it would be a call to action to prevent the violence that we can prevent. What we found in St. Louis, future studies are needed, but I think that a lot of cities are suffering from a lot of the same problems. One could infer that in the future, if there are surges from COVID-19, like future variants, that could be associated with future increases in gun violence amongst children in particular.